There's a growing interest in Jamaica and the international community in genome analysis, that is, sequencing the total number of DNA in an organism. Such interest is sparked by the significant potential to find solutions to countless public health threats that emerge and re-emerge. In support of the advancement in health sciences, the government has invested in the acquisition of a genome sequencing machine for the country. It was handed over to the National Influenza Centre, located at the University Hospital of the West Indies in October 2021.
This investment is from the government of Jamaica to the University of the West Indies, which is under the government of Jamaica, though it has a charter. And it must be for always to deliver the priorities of the government of Jamaica. Clearly, the university has a research mandate. However, when the national priorities are identified and communicated, the government expects that the resources of the University of the West Indies, those that we have contributed directly, and those that the university, through its very substantial efforts, would have raised by themselves, should be directed to those nationally identified efforts.
This machine will assist local scientists analyze genome, which is the sum total of all deoxyribonucleic acid DNA sequence of an organism.
Comprehensive national surveillance of COVID-19 will require the adaptation and reinforcement of existing national systems where appropriate and scale up additional surveillance capacities as needed. Digital technologies for rapid reporting, contact tracing, and data management and analysis may support these capacities.
We must be strategic in our approach to building local capacity and resilience. It is a critical piece of equipment which will enable us to test for new coronavirus variants. The samples which have been previously sent to the Caribbean Public Health Agency, CARPHA, will now be tested in Jamaica, dramatically increasing our response to the emergence of new variant strains. We will now have capacity to manage the endemic phase of the pandemic, because there are always now going to be new strains of SARS-CoV-2 emerging. We don't have to wait 6 weeks to know if it is here. So our policies and strategies can be informed much better than before, and so we will know what actions that need to be taken much earlier.
The National Influenza Centre is the only laboratory in Jamaica with the capacity to diagnose and isolate highly infectious viruses. The government has for some time been bolstering the centre's microbiology and microbial testing capacity with recent investments including a polymerase chain reaction PCR machine. These long-term investments will enable the country to respond effectively to the immediate needs as well as future threats.
New viruses and pathogens are being discovered and are emerging almost on a daily basis. And existing pathogens are becoming more resistant, and they are changing over time. And so the capacity of the country has to be developed for us to be able to track and trace. So when we see new diseases emerging, when we see old diseases re-emerging, we need not just to be able to treat them, which is what the public understands, but that is 10% of the problem. 90% of the problem is to be able to almost predict what is coming because you have been studying it for a long period of time.
The newest investment, the genome sequencing machine, is a key driver to such studies, and local experts in the medical and scientific community are all enthused about the possibilities.
What we're seeing here is a new service supporting public health, a new service supporting clinical care, and a new service supporting research. UHII is now part of a global network of cutting-edge labs, and the sequencing service fits exactly into what we're trying to do. And what we're trying to do is to prepare for the next pandemic.
Local scientists will also be able to use genome sequencing to assist them in providing answers to fundamental questions about antimicrobial resistance, which is currently a big problem globally. It should also assist in finding solutions for the control of hospital infections. The machine was purchased at a cost of $40 million, financed by the Culture, Health, Arts, Science and Education Chase Fund.
The Chase Fund is proud to be the funding partner of this landmark project here in Jamaica. This piece of equipment is at the cutting edge of technology, and we at Chase, we believe in that. And it will make our country proud by the service it will provide, and on top of that, it will single out us as a country, and Jamaica will stand tall in this effort because of this effort.
To ensure the machine stays up and running, Chase is providing financing for maintenance and servicing for 3 years, as well as for training and technical support.